Lerer Hippeau Ventures co-founder and managing partner Lerer Hippeau joins us now. Erica, really fascinating next phase in kind of the healthcare technology space. What inning would you say this industry is as it pertains to AI? Is this kind of the biggest use case that we could see?
It's going to be a good morning. It's going to be a huge use case. I would say that we're in the kind of maybe the second inning. At the moment, we're in what I would describe as augmented intelligence. So it's as your segment was previewing, which is collecting data so that the doctor doesn't have to do it. So that by the time the patient sees the doctor, and by the way, it doesn't necessarily have to be in person. It can also be via teleconference or video conference. By the time the doctor sees the patient, the doctor already has a lot of information about what's going on, and could be it can be prescriptive much faster.
What about the most cutting edge, use case for AI in healthcare? I mean, are we going to be seeing AI engaging in diagnoses, maybe even one day being able to, in some capacity perform surgeries via some kind of robot? Or, what do you see as kind of the most cutting edge future of AI in healthcare right now?
Yes, all of the applications you just mentioned already kind of exist in some forms. As an example, one of our companies, K Health, has brought AI to clinical grade and is being used by doctors in the clinical settings with such partners as CEDAR's Sinai and Mayo Clinic. So what happens here is that the patient goes online, answers a number of questions, typically about 25 questions in 5 minutes, and then has the option to ask for a doctor. So you can immediately call a doctor online on video, and by the time you see the doctor, which is, like I mentioned, immediate, the doctor already knows where to direct his thoughts about the diagnostics. So it's faster. It gives access to primary care in ways that has not been accomplished to this day, and it's a lot cheaper.
Eric, it's amazing how many layers there are to this story. I mean, there's the office care, there's the procedures, there's drug development, and I wonder how you think that all stacks up against opportunities in education or media or financial services, for example.
Yeah, so kind of all of the above. Healthcare is obviously a very complicated, and it's also the largest segment of our economy. But education, again, I'm talking about augmenting. I'm not talking about replacing teachers or replacing doctors. I'm just saying we need to augment their efficacy by giving them a lot of information about the students or their patients ahead of time. So it's going to have a tremendous effect pretty much across the board. AI is going to be very pervasive. It's going to be everywhere.
Eric, it seems like, there's obviously tremendous technology out there, but what about the safeguards? Would you say that, some of the protections that Bertha was talking about have kept pace with technology? Is there still ways to go in terms of making sure that there are no privacy implications, for example, or misdiagnoses or things that could lead patients, down some sort of rabbit hole of diagnoses that they don't really need to go down?
Absolutely. We need to establish we have to remember this is the very beginning of AI. And so it's immature. It gives wrong information. This is why it should be assisting a doctor, assisting a teacher, not replacing those people. But there's a lot to be done, and the industry is working on, for instance, maybe giving you a watermark so that if content is generated by AI, it says content generated by AI, so that it could be false. Right now, you don't. So we need a lot of these safeguards, but at the same time, we need to make sure that we are not stifling the development of this technology, which is really, really revolutionary.